we talk about patient centricity, and we believe it, and we want to live it, and we know that we need to partner, those authentic partnerships that Melinda was talking about earlier, partner with patients. And so our next panel, they are sickle cell warriors, and they're going to talk about their experience in navigating the health system and how they came to advocacy and how they'd like to partner with health organizations to improve the situation for themselves as patients and their fellow patients. So please join me in welcoming Dominique, Latrice, and their moderator. Thank you.
Hi, I'm Diane Bryson, and I'm thrilled to be here. I've been in pharma for 30 years, and the last 10, 12 years really laser focused on the patient. And I'm glad to see that we have brought actual patients here with us today. These ladies are, I'm going to introduce them in a minute, but I'm going to tell you a little bit of background. They both manage a rare disease called sickle cell. It is actually in the US, the threshold for rare disease is 200,000 people have to suffer with this disease. And a little less than 200,000 people actually manage sickle cell here in the US. And I'm not going to go into a whole lot of detail about it, but it's going to be interesting, I hope, for you to hear what people who have to manage a rare disease deal with on a day-to-day basis, as we take, at least I know I do, they teach me not to, take as many things for granted as I do. So I'm going to start. Latrice, introduce yourself. Tell us a little bit about you and where you live and what you do and something that's really challenging in your life.
Okay. Hi, my name is Latrice. I am 26 years old and I have sickle cell. I am not currently working right now, but I am a patient advocate. So I go to different places, I go to different conferences, learning as much as I can so I can take it back to my community and teach others about it. I have been a patient advocate for about 3 years now, and I work with Atlantic Health System with my nurse practitioner, who's not here, but I work with her to kind of bridge the gap between physician and patient and bridge the gap between pediatric and adult care. One thing that is trying for me as a sickle cell patient, there's a lot of things that's trying for me, but one thing is like right now I can't work because I'm in the hospital too often. So therefore it's lack of funds and things like that. And even with getting on a plane ride to come here, it was hard because I was in the hospital the day before I had to get on a plane. I just came home that night, which was Sunday night. I just came home that night. So getting on a plane and having a full day is kind of hard for me, which you have to go take naps and things like that, which I also had to do, so yes. And
we're going to come back and talk to the ladies about the airplane. I didn't even realize how much the air pressure impacted someone managing the disease. So Dominique, tell us about yourself.
Hello, everyone. I'm Dominique Goodson. I am 32 years old. Almost said 33. I always tend to add up. I turned 33 in November, so I always round up. I don't think a lot of women do that. I do. I round up. I'm just happy I made it another year.
Age or death.
Exactly. I'm 32. I am a sickle cell warrior. This is what we call ourselves warriors because we have to fight every day for many different things, whether it's fight with our health, fight with family, fight with insurance companies. We have to fight, so we're warriors and survivors. I started advocating for myself when I was in college about 15 years ago. I went from pediatric to adult care, and it was like a light switch. I was a princess 6 months prior, but 6 months after I turned 18, I'm a drug seeker. You're just here for the opioids. It was a complete difference, and the way the doctors just treated me was horrible. So I decided that it was time for me to advocate for myself. I'm an adult now, even though I was 18. I'm an adult now, it's time to advocate. So I started advocating for myself. I really didn't start advocating for other patients until about 5 years ago. I wanted to bring change to my community, like a real change. So I started working with the hospital, my hospital that I go to, Beth Israel in Newark, New Jersey, where we came together with the ER doctors, the head of the hematology department, and we inserted new implements, different changing. Like we have sensitivity training for the ER doctor, the new ER doctors that come in every year, that teaches them what it's like for sickle cell patients to be, what they have to go through.
I can only imagine now, we talked a little bit about this prior, the impact of the opioid crisis has changed how you present to the ER or how you probably have conversations, because they know the dose that they need. And you show up at the ER, what happens?
So the opioid crisis has, for people who have chronic pain, that our condition is considered a chronic condition, it has made things 100 times harder. I went maybe 2 months without my long-acting pain medicine because of the opioid crisis. And what people don't realize is that, I heard this quote at a lady say, she said, addicts take pills to escape, chronic pain users take opioids to live. And it was just shocking for me to her say that because it was true. I take my medicine strictly just to function. No one realizes how hard it is to just function on a day-to-day basis.
And why?
When when you're at a level of a 5 pain or higher. And the opioid crisis has just made it a lot harder, especially because if you're not on the list for it, you're just screwed.
You told me about an example of patients who are in Florida. Because of the crisis, they are limited in terms of how much. So talk about that 7-day situation.
So of course, I have a lot of sickle cell friends. So I found out this past weekend that they have like a new law for opioids. So what it is they can only get a 7-day prescription. So that means every 7 days, if they're taking an opioid, every 7 days they have to come back and get prescription. And not even for just a patient who has a rare disease, but a patient, period. Could you imagine if you had diabetes or a heart problem, and because someone got addicted to it, that's not even your fault, but a lot of people got addicted to it, now you have to go, not only call your doctor every 7 days to get a prescription, you have to also go pick it up, because what if the pharmacy doesn't deliver it, which is gonna cost you time, it's gonna cost you money and everything else. And it's making it just harder for people with chronic conditions, especially those who aren't able to work because of what they have.
Okay. Patrice, what do you want to add to that?
For me, now it's a difference, like I said, because I have my nurse practitioner, thank the Lord. But it was very difficult when the opioid, when this problem occurred, because they would not give us any medication. They would block us from coming to the emergency room. They would give us basically Tylenol and tell us to go home, even if we were in pain. But now my nurse practitioner, she has set up a guide where each of us have a binder, and for each of us, there's a guide to what medications we get, how much of the medications we get. If this is the 3rd dose of medication, then they have to be admitted to the hospital. If they're admitted to the hospital, then these are the guidelines to follow. Even though that book is still there, they still call her 24/7 just to have an okay to give us these medications. And even though she's the one who writes them, but there's still such a hold, they just don't want to give us anything. So there has definitely been a difference, because like Dominique said, my care has been lessened, meaning I don't get as much of the medication as I was before. Some of the medication that I was getting, I can't get anymore. My nurse has to even fight to give me the medication I was getting for so long. So there's some things, even though she has written in the book, they still don't want to do. So that's the...
And you were very fortunate to find that nurse practitioner.
Yes.
It takes on average, for a person who has a rare disease, it takes on average 7 years for them to be identified and really then start on a road, if there is a road, to being managed. And let alone if you find a doctor or a nurse practitioner that even understands your disease, you're very fortunate. Talk about, how did you find the nurse practitioner that you did?
Well, it took about 7 years for me to find her after I, from pediatrics. I found my nurse practitioner because I went to the hospital. My friend told me to go to another hospital because I wasn't getting the right care at Beth Israel. And I went to the hospital. I was in a really bad crisis. I had pneumonia and all. And when I went there, at that time, I required a lot of medication. I was on 8 milligrams of Dilaudid. And to some, that may seem like a lot. To me, that was just an everyday thing. That's just how, that's just how much medication it took for it to work. Well, all of the physicians were like, I'm not giving it to you. You're not getting that. It's not happening. Absolutely not. I don't know. I don't care what the problem is. I'm not giving it to you. Well, she came to me differently. And she said, I understand this is what you've been having and this is what you've been having to take. But if you work with me, I will give it to you, but I'm going to work it down where you don't have to take as much medication as you do. And
so it's just by
years
accident.
later, yeah, by accident, I just happened to run into her. And because our relationship grew so close, I was able to trust her with my care, and I didn't feel like she was trying to harm me or doing things just because she didn't like me or because of the color of my skin. She didn't trust me. I was able to trust her and fully trust her. And I put literally my care in her hands. And now I don't take 8 milligrams of Dilaudid. I only take 3 milligrams of Dilaudid. And that's about it. And don't give me 8 milligrams because I might pass out. But, so because we was able to have that relationship that's how I found her.
Okay.
And that is one of the big things, because even at my hospital, things never changed until they started taking the patient's consideration, until we as patients started sitting in on meetings and sitting on advisory boards, committees, and putting our input in and saying, look, we're able to work with you if you work with us. Don't just use us at the end of something. Start from the beginning and use us. We're willing to work with you. And once patient's voice was starting to be heard, a lot of things started to change.
So there is new guidance that's coming from the FDA called patient-focused drug development. And what that guidance is going to say is that patients should be involved in a very meaningful way from pre-IND all the way through to commercial, and this is for drug and device development. And so when we've done this before, I'm sure you know, and one of the topics that we really the audience seemed to be receptive to was this participation in clinical trials. It's hard enough to get people to participate in clinical trials, but among Black folks there's this real cultural issue around participation. So talk about your perspectives on clinical trial participation, and also, I guess that leads back into you really having some input into how the hospital manages things.
So for us, especially because we have a rare disease, it's less than 200 people in the United States with sickle cell.
200,000, yeah.
So if sickle cell patients don't volunteer for clinical trials, there's going to be no new therapies. Right. So, and unfortunately for us, a lot of, even though sickle cell, people think sickle cell is just a strictly African-American disease, it's not. It's Italians, it's Greek, it's Indian, it's some Asians.
African descent.
Like Mediterranean, anyone where there was a high prevalence of malaria, there's trait or beta thalassemia or alpha thalassemia. For the African-American culture, it's the Tuskegee effect. But I tell my friends who say, oh, I'm not volunteering to be a part of no clinical trial because of the whole Tuskegee effect. I'm like, okay, so what happened in Tuskegee? They can't tell me what happened. Oh, I don't know what happened, but I know it was bad. Okay, now you need to stop using that excuse because it's not working. Stop using the excuse if you don't know what it is. And so it's important, especially for rare disease, that patients do participate in clinical trials because that's the only way we're getting new therapies, because we can't take somebody that doesn't have sickle cell and put them in a clinical trial and say, oh, this is going to work. So for us, it's important for us to participate in clinical trials. So, but the thing is, we need insurance company, innovators, and everyone not to come to us at the end when you need us. That is, especially for rare disease, that is when we feel like, okay, we're just guinea pigs. Use us at the beginning. Start at the beginning of
help to build a protocol.
Yes, we have protocols. What do you think about this? How do you think? Let us help you design the clinical trials. It's important because if you want your clinical trial to work and be successful, starting from the beginning with the patients, you build that rapport. Now they know who you are, they know your face, they know you're not just using them as a means to an end.
And they get to better understand your life.
Yeah.
Yeah. I know for me, I did not even know that it was this many clinical trials out until I start coming to the conferences and things. So I think it's very important to kind of put yourself out there too. I know a lot of you guys come to the conferences, but there's not a lot of sickle cell patients that are at the conferences, as you can see. So kind of going to where they are, I know we was talking about it earlier, of speaking each other's language. You have to kind of meet us where we are, because we don't know that there's many pharmaceutical companies and things fighting for us. I had no idea it was that many people fighting for us until I start coming here. So letting us be a part of it, I mean, at the beginning, before you even sometimes even come up with the thing, knowing that I'm going to come up with it, let's go and let's see what's going on with their life. Let's see where we can help them. Knowing us and getting to know us, it will, I mean, us coming together, it will help, it will benefit both of us. And also because there are a lot of clinical trials out there, sometimes it's hard. Like I just recently got introduced to one through my nurse practitioner, of which one to choose, because there are so many. So again, like because it is kind of a race. So just meeting us where we are, letting us and getting to know us, and not the disease, as we talked about earlier, getting to know us personally, and so that we can work together at the very, very beginning stages. I think that's how we'll be able to.
Okay.
Yeah.
So I want to get back to your living your life. You talked about flying here.
Yes.
All three of us came here from New Jersey, and to fly, these ladies came in a day earlier because they needed to make sure they managed themselves. Talk about how the flight impacts you and what you had to do to manage that. And I get on planes all the time. I wouldn't even think about this.
Well, for me, like I said, I just came out the hospital Sunday night. So I had to have a lot of fluids. And traveling, period, I have to go into the hospital, get fluids, get medication to make sure that I'm okay to do whatever I am doing. So it's a lot of fluids. I have to make sure I'm taking my meds, especially my extended medication, so that I can make sure that my body is at a baseline for whatever impact it's about to feel flying and doing any type of traveling. But I know it's like it takes a lot of like oxygen.
Talk about that, yeah.
The pressure.
Okay, so the pressure of the airplane, like especially like when you're going up, it kind of, our cells are already deoxygenated because of the sickle cell. So the altitude, the higher you go up and things like that, it kind of strains you. It deoxygenates those cells even more. So we take the hit of that, and we feel it. So that's why we're very tired. We don't have much energy to give. So the day before, like she said, we had to come in. We had to make sure we got rest and take our medication.
And this was for a 45-minute flight?
Yes.
Okay.
Yes.
So I actually learned my lesson about flying with sickle cell the first time I flew when I was in high school. I was going to a Future Educators of America's conference in Jacksonville. And it was the first time I flew. I was so excited, but once we landed, it was a wrap. I had a crisis attack. I didn't realize a crisis attack is, or a vaso-occlusive crisis attack. It's pretty much
patients are the experts,
pain.
Right? Yes. Right.
It's pretty much pain in a localized area, whether it's chest, legs, your joints, your arms, your back. It's pretty much just, it's pain. And I had a crisis attack landing. And I realized when we flew back that I slept the entire time and was fine. But the thing was, the plane we were on was a different plane than the one we came in on. The pressure, it was pressurized differently. So I kind of came up with the method that I do where I fly, where I go to the doctor 2 days before, I make sure I rest, and I make sure nothing that I do the day I fly in, at least 3 or 4 hours, so that I'm rested, hydrated, everything. I think a lot of people, especially sickle cell patients, don't really know that if they don't talk to their doctors, and that's one of the things that's like a big thing in our community. A lot of sickle cell patients don't have healthcare providers because they don't trust them. They feel like they don't care. They feel like once we transition from pediatrics to adults, we are seeing completely different. We are no longer the little princesses that we were, and now we're a whole different type of thing. So they don't want to go to the doctors because they don't trust them, so they don't know.
And then how about the whole issue about the family not even wanting to talk about, you manage sickle cell to the world?
Oh yeah, well that's more of a cultural thing. Yeah, I was raised with what happens in the family stays in the family. I'm pretty sure that's not just a black thing. I'm pretty sure. I'm not positive, but I'm pretty sure. But because of that, a lot of sickle cell patients don't talk about anything that's going on. I know people that say they have friends for 20 plus years, don't know they have crisis attack, don't know they have sickle cell. One of my friends right now, she's about to get married. Her husband doesn't know she has sickle cell. And it amazes me, but I completely understand because I really didn't start talking about what I was going through with sickle cell to my friends until I was in like 8th grade.
All right. So with that, we really want to thank you two for coming here and sharing your experience and helping us all understand how you manage sickle cell.
And I just want to add one more thing for everyone in here. Think about the patient's need. I know a lot of people think they know what the patient wants, but maybe once in a while actually go out and meet whatever patient, your population that you're going to, whether it's diabetes, whether you're helping out someone high cholesterol, cancer, whatever it is. Meet maybe one person and get their story. That way you could put a face to the disease or a face to the condition so that it's just not you're in a lab or you're on a computer. You actually get to meet and talk to them. It's very helpful, and you will find that a lot of patients are willing to help with any kind of design, anything you think you need. We are willing to help and actually be there from the start. Especially if we could be there from the beginning, we will. So go out there and talk to the patients. Even insurance companies, because I got a few things to talk to you guys about too later.
We got to wrap up. Okay.
They're right.
With that note, I don't think I could add anything to that. Okay. Thank you very much for having us. Thank you. Okay.